issued out of this cabinet will always be issued to a patient. You'll never be taking out anything otherwise. If you do, well, no. Everything is monitored, and you guys, I have access to this cabinet and what's going on in this cabinet from my phone. So we monitor these and we know exactly what's going on. So no funny business, please, because we will know, and as a pharmacy, we will prosecute. So just know that up front, because I am one with no surprises, and we have had to do it before, unfortunately. So just be aware of that. When you get to the cabinet, after you've sent all the orders, you'll want to fingerprint in. You do not have a username or password. So go ahead and fingerprint in. Also remember what finger you used.
Same when you walk in.
One more time. It'll turn red as it's going. Yep, this one's red. Perfect. So it's gonna have all of the patients listed here, okay? This here is a search box. You can search for any portion of a patient's first or last name. I recommend doing just a couple of letters of their name, just to be certain. Sometimes people's names, like the spelling, gets mixed up pretty easily, so just the fewer letters, the better. Also, if you put a space in there, it'll mess up your search too, so don't do that. Just a few letters. So what you guys will see with most patients, when you select them and you hit issue return, all the patient's items are going to show up automatically. Okay, is this how the other CubeX was? Okay, so you'll have all of the items on here. If you hit no, it'll tell you more about what the script is. If it says 0, so this is a Norco, right? I'm like, can barely see it. Yeah, so this is a script for Norco. So this one, this patient takes 2 all the time, whatever. If for some reason it populates as a 0, it's a ranged PRN, 1 to 2. We have no idea how many you need. You would know because you should have already asked the patient what they need, right? So the patient is indicating how many they want. They're on a scale of range from 1 to 2. They're telling you how many they need based off of whatever scale you use, right? Right, so yeah, the pain scale. So you would be typing this in here. So you just tap in the yellow box and change the quantity to what you need. For that dose, you're only pulling 1 dose at a time, okay? Once an item comes out of here, it does not go back. There's a no return policy, okay? All of this stuff is owned by the pharmacy. This is our inventory. This belongs to us. It becomes your property as soon as you take it out, okay? So as soon as you tell me you're taking 2 Norco out for a patient, those Norco belong to the facility now, okay? So I'm just like, so you guys can see this, it'll say note on here. If it's a PRN, it'll tell you up towards the top that it's a PRN, and it's in capital letters, so it's pretty easy to see. And then tells you the SIG, so it'll tell you that they need, 1 to 2 or whatever it is that they need. So just, if you're questioning why it says 0, just tap in the quantity box and change it to what you need, okay? Sometimes it'll do that. It'll do that also with nebulizers or inhalers, or a bottle of Roxanol, or a bottle of oxycodone. Those are issued out per mLs. The system recognizes it as a bottle, not mLs. Does that make sense? Okay. So that's just so you can see a patient profile. So we're going to take some stuff out today for Frank Sinatra. So you go ahead and search for him, please. That's our test patient's name. Yep, right there. S-I-N. Perfect. And then you want to hit enter or search to narrow your results. Then you'll tap on his name and hit issue return. Okay, so Frank Sinatra doesn't have anything on here because he's a test patient, right? So for non-controlled items, supplies, anything up here, you guys can go ahead and grab those items out, okay? So, and this is going to be the same. There are going to be certain people that have permissions to grab controlled items out. Same process, all right? If someone says, if someone tells you to go ahead and complete an override, what they're really trying to tell you is to go ahead and add the items, okay? So the verbiage on the button is add items, so we're trying to get the people in the pharmacies to start saying add items because that makes more sense to you guys, because that's what you see, right? So go ahead and hit add items. And we're going to grab out some cefazolin once the entire list loads. It's going to take it a second. This is the first time it's loading since it's started up. So you're going to, right here, no, you can actually use the search box right there. As you type here, it will actually narrow. So C-E-F, oh, it's right there. Yep, that's perfect. So once it's blue, it's selected. You can hit next. Declare how many you want, which will be 1. And then hit next. So this will start to build a list. You see how it looks very similar? This automatically makes sure the box is checkmarked and the quantity that you entered is going to fill in there. Okay? So on the other list, you make sure that the items that you need for that pass are checkmarked and the quantities are accurate. Same thing, except these automatically checkmarked because you're adding it to the profile. Does that make sense? Okay, perfect. So we're going to add one more item because I want you to see how this works. Yep. And you're going to type in 0.9. And then we're going to grab the 1,000 ml bag. I think it's the third item down. Third one. Okay, and then hit next. Declare how many you want. One, yep, and then hit next. Okay, so that's anytime you guys need to add an item. So, I believe he said in there, I was doing a lot of things at one time while we were in there, so he should have said that any non-control supply items, all that you can grab without calling the pharmacy. Okay.
That's what I was asking him.
Yeah, for non-control. So for controls, you have to call the pharmacy if it's not there. If it's already there, we have a valid order, so you can go ahead and grab it. If it's not there, call the pharmacy. Okay? So I just want to make sure that we're very clear, because sometimes we get calls and it's already sitting there and you're asking for a code. There's no code. Right? We're not asking you to put in a code. If it's there, a pharmacy has verified it. A pharmacist has verified it. Go ahead and grab it. If it's not there and it's a controlled medication, call us. If it's a non-controlled medication, add it. Okay, just go ahead and grab it. I mean, sometimes you get weird things, like a one-time order for furosemide. Like, don't just grab it. Or an antibiotic that you need to start right away. You guys have 2 hours to get that going, right? We don't want to interrupt that by you making sure you have everything, and we're go ahead and grab it and just do what you got to do. The only thing that we're super concerned about are your control medications. Okay, they're way more regulated than all the other stuff. Now, of course, make sure if there's any kind of indication that there might be an allergy, make sure that you guys are checking your Mars and stuff before you start an antibiotic too. Okay. All right. So, after you verified that everything is correct, so you'll have the patient name up here. You verified that the patient's information is correct. All of this is correct. Everything's good. You'll hit issue items now. Oh, go back to show item list. We're going to hit issue items now. Okay, so the appropriate drawer is going to pop open, and all of these are really long, so I'm going to have you step back just a tad bit. All of them are really long, but the drawer opens and the cube opens. Is this the same system that they had over there? Perfect.
I had in Idaho.
In Idaho? Which facility in Idaho?
Valley View and Boise.
Oh, okay. I've got an app there. Yep. So there's a couple of things. These are pieces of equipment, so sometimes they like to be a little stubborn. So just prepare yourselves for that. You guys can tap on them. You guys, and like when I say tap on them, if you're doing this, it's not gonna do you any good. So like tap on them. Okay. Tap on the one you want to open, not the one next to it, just to be clear. But you can see there's a little lock right here. There's a little brown lock. You'll see it pulling back, and sometimes it just gets a little stuck. Okay. The other thing that I'll do is if I know what I'm looking for, and you'll get used to the setup because things aren't moving once they're in there. You can get your fingernail on there and help it open. It has to be unlocking in order for that to work though, okay? Because they're good, I promise. Now for some reason it doesn't open, or you forget to grab your medication, the retry button, excuse me, we'll pop it back open for you, okay? That retry button in the left corner is very handy. Use it if you need it. The screen's going to tell you I'm taking out one and there's 3 left. If that's accurate, great. If it's inaccurate, let one of the administrators know, which is Myra, Virginia, and Marianne. That's your DNS rate, DON. Okay, so let one of them know they can correct the count, and I'll show them how to do that. Okay, so we'll take one out, close the lid, and then close the drawer. All right, and then you'll hit next. Okay, so this is going to come unlocked, and then the appropriate spot is going to flash. So it's really quiet. I was trying not to talk during it because sometimes you can hear it. Usually I just talk right over it and then no one hears it. When you're here by yourself, you'll probably hear the click. It's very subtle. It doesn't make a lot of noise, and it doesn't pop open at you automatically like some of the older machines do. Okay, so you'll open that up. You'll see how the light is lit up green too. So you open that up, and the appropriate spot is flashing. Watch your head. So you'll hit the green take button. You guys, this green take button is important. because that just indicated to me that you're actually taking it out. Okay, there's no shopping up here. So if you get in here and you realize you would really like a 100 ml bag too, that's great. Get back in here and tell the machine you're taking it out. I have no idea that you're taking it out if you go shopping. Okay, so you'll take one out. It says if you take one out, there's 2 left, and there really is.
Oh, okay,
She's all.
Okay, and then you can close this and watch your head, and make sure you get it closed all the way. Perfect, just like that, and then you'll hit next. And it'll say all items have been issued except whatever you skipped, and then you're done. You'll hit exit before you leave. The most important part, hit exit before you leave. You don't want someone coming in after you. I know you guys are best friends, and you all trust each other, and you would do anything for each other. Don't put your license in someone else's hands, please. Okay, so you'll hit exit. You guys, one of the things that I didn't say earlier, I alluded to it. So we do monitor everything that comes out of here, right? Don't put your license on the line because you're not taking your time, okay? When controls open up, there's gonna be a screen before this, like it was with this one, it just automatically goes to like take something out. With controls, it's gonna ask you to declare how many's in there before you take anything out. So the easiest way for me to reference this to your everyday life is that when you start your shift and you count the control drawer or your narc drawer, you guys are counting what you have right now at the start of your shift, not how many's going to be in there when you're done with your shift, right? Same thing here. It's what you found in there before you take anything out. So and this is based off of your declaration. So be very careful, pay attention. We can track it. Sometimes people just like are in a hurry, but take that extra 5 seconds to make sure that you're doing the right thing. Okay? It's really simple. It's just new. All right, and my recommendation is never overthink it, because if you're overthinking it, you're thinking too hard. This software is like landing. All right, so I have somebody that I worked with a lot up in Washington before I started this position at Payless, and she's like 65 years old, and she literally logged herself in and did all of her own stuff, like while I was training somebody else, and I came out, she's like, okay, all done. So it's not, she'd never been trained on it, okay? It's not hard, just don't overthink it, okay? And that's it.
Do we have to count this with a med pass?
Yeah,
No,
that's what I
you
was
do not.
thinking.
We're all thinking the same thing.
Yeah, that's a great question. No, you do not. You don't. It's just
Okay.
the
I didn't know if like we had to log in and it would pop out like a couple of drawers and you had to just account for what was in there.
No, we don't require that. And I'm going to talk to Virginia. She may want to do a cycle count of the controls to verify what we actually put in there. Just because we have had some questions from other facilities on that. But no, we do not require that.
Okay.
So some states do. We do. The
I
California
know in
does not.
emergency rooms and stuff
Yeah.
they do, so
Yeah.
that's why I was asking.
Yeah, the state of California does not require that.
Theirs are smaller though, so I think, I don't know, they're different. I know
Yeah.
in Idaho we had to count and stuff.
Yeah,
have a
and every
pharmacy right
pharmacy
there.
is different. Every state's a little bit different. So yeah, you guys should get what's up.
I know you sort of reiterate, but say I was in here getting something and Phyllis was like, hey, give me a license for so-and-so.
Nope.
I should get her
You
some.
should only pull what it is that you're administering.
Okay.
This is why you only pull one dose at a time too. So I had a facility that got 3 tags because they pulled multiple doses of controls and they were sitting on the cart, and then they were being really nice because, you know, their friend was coming on after them and they were going to help them out by pulling from the CubeX for them. They did not administer the meds they pulled. You guys, if you guys are pulling, you should be administering it.
Okay.
All right? So just keep that in mind.
Okay.
So it's always it's great to do nice things for your friends. If it's not within regulation, just don't.
No, just
Yeah.
curious.
No, it's a great question. I'm just saying, like, we have facilities that do it all the time, and unfortunately, like, it's one of those. I've actually taken access away from nurses because she wouldn't stop. There was one nurse specifically, she would not stop pulling multiple doses, and once you take it out, you can't return it, first of all. Second of all, what if they don't even have that, like, of that many quantity left on their script? You know, so there's just so many things that you can run into with that. And if, so they got 3 scripts, so 3 tags, so they had unmarked controls on their cart, so they weren't, like, patient specific. Somebody else administered the drug, and then there was one other one. but there were 3 flags that facility got from state because state walked in and they had those just sitting on their
So
cart.
we'll still have narcotics on our cart.
Oh,
There.
yeah.
Okay,
This is just
extra.
e-box.
This is like our
Okay.
emergency.
This
kit.
is just e-box first dose emergency. Okay, so exactly what you do with your tackle boxes, except now in a machine or whatever it is.
In an
have-
emergency, when the
Yeah,
power
got it.
goes out, you said that there's a battery on it, but for how long
for
only?
1 minute. However, Davis and I are gonna.
So
you guys
one
have
of
the
your
battery.
responsibilities, make sure that somebody gets an extension cord, plug it on a orange wire or a red wire, is what you need to do. There's about 20 feet away.
So we need to make sure we have a cord long enough.
Yeah,
Probably should just have its own emergency cord in here.
which we should, but we don't. It's not a red plug.
No. I'm just saying we should have the cord that's the appropriate length already
Oh, that
in
would be
here,
good, yes.
and that way all they have to
I
do is
think
plug
that's
it in.
something that we can put on top of the machine. Would that be
You guys
okay?
have a lot of power outages here.
We did.
We do
last
get
night.
power
Did we
outages,
last
so
night?
we don't want to
It's
take a risk.
flicker.
Did you say last night?
No, but once a month they're testing the generator now, and it'll be off for 30 minutes.
Exactly.
Okay, yeah. So
So
I'll
it should
work
have
with-
its own cord.
No, every
That's
Tuesday,
smart.
actually
Like,
every week.
It's, I mean, emergency
check that
practices
every
is always
week.
good, especially in homes like this.
Yeah.
But we
So
should
it needs
do
its
that.
own cord so that it doesn't get forgetted.
Yeah, so-
I mean, we need it.
So
all
all
the
of you have to know that. Oh, the CubeX, we need to make sure it's powered.
I'm trying to do our minutes.
Because next thing you know, you will not be able to access the.
Yeah, and it'll once it's back on, like once it's plugged back in, it'll automatically power up. But
It's gonna make it
it
bad.
doesn't lose information. It doesn't lose information, no. So and then if your internet's down for that 30 minutes, once it's connected to the internet again, it automatically syncs.
Well, if internet's down, it's not gonna work
I
anyway.
No, you
know.
can still pull.
Oh, you can still pull.
You can still pull. So the only thing is that if you guys have new orders that you just sent over, they won't be showing up until we have internet again.
Like call right
Yeah.
away and pull this or whatever.
Well, then they would just send it to the pharmacy, and the pharmacy would deliver. Right? If our
Are you saying like
If we had a
like
power-
a satellite situation?
yeah. If we had power,
Yeah.
I'm sure they'd figure it out.
Yeah, and you guys have people that have override access
Put
in
a thermometer
emergencies.
in here also
anyway
in
for
regards to
controls.
temperature to monitor.
So,
Marianne, Virginia.
yeah, not all right.
Yeah. Don't have an emergency.
But if there is an emergency, they could always come in. You know, like that's the thing.
Marianne does. Marianne does the
Yeah.
rule for us. She comes in all.
That's a good deal. Then, gotta take care of your people. When you're leading people, you have to make sure that you take care of them. I'm a big believer in that. I have a team myself, and I never ask them to do anything that I wouldn't do myself. So that's it. If you guys have any questions or concerns, let us know. Oh, 24/7 access to support. So if you're having issues with the machine, call CubeX. The 866-930-9251. If you guys are having issues getting a hold of them, let me know. They would much rather hear from you than they would from me. Okay, so I'm just gonna make sure that's very
So
clear.
we're having a problem inside the room here and the phone is across it. We could use our own.
Yeah, I use myself. You guys can do. And sometimes if I have issues, people will like say, "Hey, can you just call me on my cell phone so I can get in front of the cabinet?" And then you guys, this will be attached here, and this is everything we want to say.
Oh, that
And
contains
it
everything
stays-
that's in there?
It stays attached, yeah.
Okay.
So, and then this I'll take off and give
And
the.
if we need anything added to the e-kit,
Talk to the pharmacy.
talk to
you
the
guys.
pharmacy.
Yeah.
Just in
Because
case
there
we
is
need medicine
A
that,
ton of stuff in here though.
okay.
So in the tackle boxes, they can only do like 48 oral solids. I believe it's really limited in the state of California. There's no limit with this. So you guys have lots of warfarin, you guys have nystatin, you guys have penicillin cream, you guys have, let's see, you guys have.
Wait, that's exciting. Though.
I know, I think of like all of the fun things we put in here that nurses get excited about. All of your IV supplies are in here and in here. There's lidocaine patches in here. There's way more stuff in here than you guys are going to have.
That we've ever had.
That you've ever had.
All the medications are in the kit.
Did you
She
see
said
that?
I'm gonna print it out. I'm gonna after I load it, then
And
I
your number?
do it. I only give my cell phone number to the DON because there's a 24/7 access to CubeX.
Okay.
Yes. Otherwise, I mean I literally calls all